I want to applaud NHP Foundation for providing the thought leadership that really is needed at this time to create a conversation between the healthcare industry and the housing industry about how we can achieve greater housing access for more Americans.
One of the themes that keeps coming up in our own resident population, and when surveying others, is the direct correlation between safe, clean housing and individuals' health.
Throughout my clinical career, a large number of my patients wanted me to work with them, not necessarily just on treating their high blood pressure or their diabetes. A lot of my patients really needed help with figuring out where they're going to sleep that night.
We have seen that taking care of people and putting a roof over their head actually helps increase the quality of their health care, because affordable housing is a prerequisite to keeping people healthy.
In healthcare these days, we talk a lot about the social determinants of health. We talk about the need to embrace the fact that the people that we serve within the healthcare world have social needs that oftentimes trump their healthcare need. If we don't address the social need, whether it's housing, food security, you name it, we're not going to be successful at meeting their healthcare need.
It's not a stretch to say that as your quality of housing improves, your healthcare most likely improves. If you're not focused on trying to find a home every night, then you have the ability to focus on other things that are important, like your own health.
We're also starting to see that affordable housing actually leads to healthcare savings. Things like reduced Medicaid expenditures, fewer emergency room visits. You can imagine going forward that housing agencies and healthcare agencies will start to partner more, realizing just how tied together healthcare and housing are.
We are proposing nothing less than an affordable housing paradigm shift, calling upon our industry, as well as partners in healthcare, investments, policy, and social services, to explore a variety of strategies, including the idea of a new collaborative funding model of privatized housing vouchers.
Vouchers help residents that they serve, but to be effective, there needs to be a unit available where the voucher can be used. What would be even better would be a long-term partnership with the healthcare sector. That long-term commitment could be used to support financing that would help create and increase the supply of affordable housing. One of the most impactful health initiatives our country can have is to increase the supply of stable, healthy, affordable housing.
What we are trying to do is highlight some of the best models and encourage other hospital systems and health plans to rethink how they traditionally provide health care. A prescription for housing.
National data suggests to house and give support for an individual for years between $18,000 and $25,000. There's an obvious ROI for investing because there are all these silos of funding. If those could be bundled into one, and the services customized for that individual, and it's a one-stop shopping for the hospital, that's a really powerful thing.
We have individuals who don't have access to stable, affordable, effective housing. And as a result, collectively, we're spending more money than we should. There is absolutely an opportunity for those two sectors to work together in systematic ways. It doesn't mean that healthcare as an industry can solve the housing problem in the United States, but it can definitely be part of a broader set of solutions.
I think that it is well within range that a partnership can be conceived where housing providers and health providers can join together in providing a quality of life. We are trying to give a sense of normalcy to what family life, community life should be.
As we demonstrate the effectiveness of the programs that we've created, we're very interested to share this information with our hospital systems, with our health plans, with outside investors, to demonstrate that when you truly invest in social determinants, you not only meaningfully impact an individual's life, but there also is savings. And so I think what we've created can be replicated over and over again.
We're hoping that starting tonight, this subject will receive the innovative thinking it deserves, stimulate discussion and debate, to develop new ideas, and to make fundamental changes to the intersection of affordable housing and health.